How does IgA deficiency impact celiac disease testing? Imagine going to the doctor for a blood test to check for celiac disease, but the results come back unclear. That can happen because of a condition called immunoglobulin A deficiency. This condition means your body makes very little or no immunoglobulin A, which is a type of antibody your immune system produces. Since most celiac disease tests look for these IgA antibodies, having IgA deficiency can make the tests less reliable. The most common test for celiac disease measures tissue transglutaminase antibodies of the immunoglobulin A type, called TTG-IgA. When IgA levels are normal, this test is very good at detecting celiac disease. But if someone has IgA deficiency, the test might say negative even if they actually have celiac disease. That's because the test depends on the presence of IgA antibodies, which are missing or very low in these individuals. To avoid missing a diagnosis, doctors usually check total serum immunoglobulin A levels along with the TTG-IgA test. If the total IgA is low, it indicates IgA deficiency. In this case, the standard IgA-based test might not give accurate results. Instead, doctors will order tests that look for immunoglobulin G antibodies. These include IgG tissue transglutaminase tests, endomysium antibody tests, and demetated gliadin peptide antibody tests. These IgG tests work well because people with IgA deficiency still produce immunoglobulin G antibodies normally. Understanding this is important for anyone navigating gluten-free living. If a person with IgA deficiency relies only on IgA tests, they might get a false negative result, delaying diagnosis and treatment. That's why healthcare providers need to use the right tests based on each person's immune profile. If serologic tests are inconclusive but symptoms suggest celiac disease, a small intestine biopsy might be needed to confirm the diagnosis. Monitoring a gluten-free diet in IgA-deficient patients can be trickier because IgG antibody tests are not as reliable for tracking diet adherence. Instead, doctors often relying on symptom improvement and clinical follow-up. In summary, IgA deficiency can cause false negatives in standard celiac disease blood tests that measure IgA antibodies. Checking total IgA levels helps identify this issue. When IgA deficiency is present, IgG-based antibody tests are used to diagnose celiac disease. Sometimes a biopsy is necessary if blood tests don't give clear answers. Being aware of this helps ensure accurate diagnosis and proper management for those living gluten-free.